It's gonna be my first YouTube video ever, so bear with me if you hear a lot of ums or I need to kind of take a pause and rack my brain for a second. I'm just gonna do this one kind of off the cuff here, and kind of have it naturally flow out. I thought a script would be a little too much, so it's gonna be the first video on my channel. And it's just going to be about kind of the past 1.5, 2 years or so, which was the undoubtedly the worst period in my life. I had some terrible medical issues pop up, and just those really kind of tore me down a peg and changed my life entirely. And just wanted to share my story on this channel and hope I can, relate to anyone else or give help to anyone else who goes through similar things to me, because a lot of these issues are kind of niche and there's not a lot of, data or videos out there. And I know this would be helpful to others if they had something like this. Additionally, kind of as a preface to this channel, just kind of want to share my story again. And, I'm trying to work my way back to a place I want to be at, in terms of physically, mentally, all those things after you go through stuff like this. So just want to share that, probably, post some workout videos or rehab videos and kind of delve deeper onto each of these topics and medical issues I have, because had to do a fair amount of research myself for a lot of these things, and think I have some good wisdom to share at least. So let's kick it back to the beginning here. So just a tiny bit about me. I'm 26. I live in the DMV area. Won't get too specific on that. Of course, I'm a software engineer, and yeah. So prior to all this, the first injury I'm going to talk about is a back injury, right? A herniated disc. So, or I guess the first medical issue as a broader term. But anyway, so before all this, a lot of my main hobbies revolved around weightlifting, running at the time, being active in general, fitness. I was kind of into the whole biohacking kind of health sphere a little bit, and just enjoyed feeling healthy. That was very important to me. And probably the biggest out of those was weightlifting, going to the gym, fitness, bodybuilding. I watched and still watch, a bunch of fitness YouTubers and all this stuff. And, going to the gym was an integral part of my life, and was probably my biggest hobby. Anyways, I have some other interests as well, obviously, but, they don't super relate to the story at this time. But anyways, so it's all going to start around April 2024, beginning of April. And so what triggered it, right? So I was in the gym one day, doing leg day, I think at the end of March or just a few early days of April. And, was just doing my thing in there, and was doing a set of, fairly heavy hack squats, and, completed those, and then moved my way to the, some weird glute bridge or hip thrust machine, something I don't normally do, but was kind of experimenting with, and ended up, starting my set on there, and felt some weird. It was so long ago, or felt so long ago that I don't, fully remember all the specifics of exactly how I felt, but I felt like I kind of tweaked something, perhaps. Maybe felt a little unstable in the back, and while I was doing my first set of those hip thrusts, um, and anyways, yeah. So I kind of felt little minor tweaks in the past, maybe around my back area or SI joint area, which I know now, but I was kind of unaware of the whole back in general or and anything or injuries related to that at the time. But I had a few minor tweaks there. I'd be in the gym, I'd have a tweak in my shoulder or wherever. But and this one honestly didn't feel that much different. It felt maybe a little worse, but at the time it didn't feel too serious to the point where I was like, okay, I broke something forever, or this is gonna change in my life. So um, I kind of felt that weird twinge in my back, tweak, whatever you want to call it, and I was like, okay, I'll take it easy throughout the rest of the workout, but I still completed it, although I was kind of feeling strange the whole time, a little unstable, like I said, but I just kind of regressed to you know machine hamstring curls and calf raises and leg extensions, and those things aren't too aggravating, so I just kind of did a bit of those and kind of finished up my workout and left. Didn't think too much of it. Thought maybe it was just a tweak, it would go away a couple days a week, but so fast forward to, I believe, that night or maybe a day afterwards. It's a little foggy. I became a hunchback virtually. I I remember being in my living room. I was on all hands and knees, just kind of unable to like really stand up or operate properly. And I kind of started having an inkling there. I think that this was more serious than usual, but I didn't think it was a terrible injury. I thought it would again go away in a few days, week. But the kind of so I think the next day or maybe a day or two after, I'm still feeling pretty bad, and the time I knew I needed to go to a doctor was I was gonna go get breakfast with my family, and I went to this kind of little deli spot, brunch spot, and the chairs there were horrendous. And I remember sitting in a lack of lumbar support chair, and the pain was so bad there with my parents. I was kind of squirming around, they could see it, and eventually the pain was so bad after, I don't know, before I even got my food, that I just said, I gotta leave. I couldn't sit in that chair, and I drove home, and I think I scheduled a doctor's appointment for maybe the week after, or a couple days later. And so then I have the doctor's appointment early April, like I said. Uh, Initially, they just typically give you an X-ray, which I got, to see if there's any obvious defects or what have you in your lumbar spine. And then the doctor came in, he took a look at the X-ray. There was some lowered height on the L5S1, so we assumed it was some sort of disc injury at that level, but didn't know exactly what it was until you get an MRI, obviously. So then this leads into kind of the next maybe 2-ish months of a particular pattern. So he tells me this, and then normally what they're going to do is they're going to give you a steroid course for maybe a week. You take it for 6-7 days, you taper down, and he'll give you some muscle relaxers, take some Tylenol, whatever, and the and then they're gonna give you a script for PT, which I did. So that was kind of my plan there. And the steroid course is kind of a nuke when it comes to this back pain stuff, it's going to really, especially if you're kind of acute and early on into this journey, it's going to kind of nullify your flare up pretty quick. So it'll take the pain away within a week or two max, or not take the pain away, but it'll significantly help you to the point where you're feeling, good after it. And so I did that, and um, at the time I was, lifting, running multiple times a week. This kind of those activities were, big hobbies of mine, like I said, and were just like ingrained in my head. I couldn't let them go, right? I couldn't imagine or really function as a, sedentary type person who just kind of, I couldn't accept the reality of just walking around and only doing kind of sissy PT exercises. Just didn't click with me at the time. I didn't understand the brevity of the injury, but basically, I had 2 months where I would take these. I had the first month I would take the steroid pack, and then I would feel kind of better in a week or two, and I would, slowly, but albeit stupidly, go back into the gym. Not even that regressed or changed that much from what I did. I probably didn't do like heavy squats or anything, but I was still lifting, heavy weights like 2 3 weeks after this incident. I was, um, and then running as well, a few miles and stuff. And that was pretty stupid when you look back at it, but it was just, you don't really learn until you hit rock bottom. So, or you don't appreciate the severity of an injury like this. So I basically re-injured myself maybe a month after the first time I went to see the doctor. I believe it was just doing heavy incline dumbbell press at the gym. Felt that some sort of tweak again, and flared me up for a week or several days or whatever. And so I went back to the doctor again, I believe, and since it was continuing, we decided to get an MRI. I believe the time frame's a little fuzzy, like I said, it was a while ago, but get in order for an MRI, get that steroid pack again, feeling good, and 1 2 weeks. This time but I still have this mentally ingrained pattern in me that I gotta lift, gotta run and stuff. So I this time I was a little more safe with it, but I and regressed it a bit more. But I still, tried to go on several mile runs and lift in the gym to a good extent. I mean, this time I was kind of trying to avoid any real compression there, and more so regress things. But anyways, then another month, kind of similar pattern after that doctor's visit. I kind of re-injure myself again, and get flared up. And I forget again when exactly I got the MRI, but it did show that I had a herniated disc at L5S1. The proper medical term is it was an extruded disc on the right side, going 5 millimeters outwards, which compared to some other disc injuries I've seen isn't terrible, but it certainly feels terrible. So, what were my kind of symptoms throughout all of this? And it's kind of changed throughout the years, but initially, or throughout the year and a half, 2 years, but initially, when you're in those acute stages, it felt for me like there was some sort of compression in my lower back. Like you honestly felt like you were a little shorter or kind of compressed in a way. And you felt unstable there, maybe a bit of pain in the mid back region, and directly on the lumbar spine. And then I had some weird a lot of weird tightness and, intense kind of muscle guarding and cramping on my upper glute area, kind of around there, lower back. And then I did have some pretty, moderate level, sometimes severe sciatica. Uh, Again, only on my right side, because that's where the side the disc was pushing on. But if you've ever had sciatica, I mean, that's one of the most annoying and terrible things to live with. You can't really get any relief. That's one of the bad things about back injury. If you got a isolated ankle, knee injury, you can kind of splint it. You can not walk on it. You can avoid kind of pain in some manner. But with a back injury, you can be sitting, lying on your bed, standing, what have you, and it's gonna hurt the whole time probably, and you can just have nerve pain just lying in your bed, and it's infuriating and excruciating at times. So, and sometimes I would not maybe be delusional in a way, or like I don't know. I had weird theories that maybe if I'd feel the sciatica pain and I'd be like, oh, maybe I just loosen myself up. I get to go on a run for a few miles. It'll fix my sciatica. And didn't really work in the long run. I think at times I maybe thought it helped just because the adrenaline response, or just like you get your body moving, it kind of feels less painful. But those were just not true and kind of foolish of me. But anyway, so 2 months in, I realized this is a serious injury, and I kind of accept my fate that after that second re-injury, I was like, okay, I gotta give up the things I love. Basically, I gotta give up weightlifting mainly and running as well. So I just focus on walking and PT. I just want to go ahead and give a quick aside on the PT. So I was in PT kind of these first 2 months, but wasn't really that effective, and they weren't really able to give me that much insight. At least the first place I went to was more of a kind of cookie cutter chain type PT place where they'll give you generic static stretches, clamshells, glute bridges, and things that are kind of maybe good in the initial stages, but really, in the end didn't and won't, I think, move the needle that much for most people. So that was kind of my experience with PT. By the end of those 2 months, and it's partially my fault, but kept re-injuring myself, and they honestly kind of gave up on me. They were like, we gave you all the exercises pretty much, and there's nothing else we can really do for you after, in my eyes, kind of the minimal. I have no bad blood with them, but it was kind of minimal treatment modalities they gave me. But anyway, so they kind of dropped me in a sense that there's nothing much we can do for you after this. So they referred me to kind of a pain management doc who gives the injections in your lumbar spine and SI joint area, what have you. And so after I get the MRI, confirm things and my foolish ways of running and lifting, I change PTs to a kind of better, more smaller place that had better care to a good extent, and had a better program, did more intensive kind of exercises, and was just generally a better fit. And additionally, I got some injections, I think 2 injections, kind of several weeks apart, around maybe late June, early July, into my, it's an epidural steroid injection, and it's supposed to kind of relieve pain, inflammation. So I got 2 of those around that time, and was on this new PT regimen, and stopped the aggravating stuff. So next few months go by, I was on a much better path. I this new PT was helping me a lot more. I started doing a bunch of research on the back. I, learned all I could. I was doing some McGill stuff on the side, as a lot of you with back injuries know. Big three. I forget exactly what else I was doing. I was kind of mixing it with the PT regime, but so several months into all of that, I was on a much better path. I was feeling a lot better, a lot more hopeful. Could sit down for a lot longer, stuff like this, and things were looking up. And I was thankful for that. But still nowhere near out of the woods. But then we're gonna shift gears a bit. Something, another terrible medical debacle kind of hit me out of the blue in August 2024. So kind of mid-August 2024. For some reason, I was having some weird kind of abdominal pain, like GI issues, whatever, stomach ache, for maybe a week or two, I think. Again, this is kind of vague. It was a while ago, but I ended up, going to the urgent care, just trying to see what was up. They, they make you do they wanted to get a urine sample from me, right? But I, couldn't go at the time. So I chugged like two, 16-ounce, whatever, standard water bottles, just trying to give that urine sample. And for the condition I have, that's one of the worst things you can do, but I'll get into that. But so I did that, gave the urine sample. I go back into the room with the doctor, and maybe 30 minutes, an hour after I chugged that water, I start getting this strange pain that I really hadn't felt before ever in my life on my actually my left side flank. So flank meaning kind of your area right here, near your lower back, but to your side. And didn't know what it was, but the kind of nurse practitioner came back and she was like, "We found some blood in your urine sample, so we can't really identify much here. You should probably go to the ER for something like that." And so obviously I was, concerned a good amount, and this flank pain on my left side kept getting worse and worse as the next few hours progressed. So fast forward, I kind of call my dad, I think, and he takes me to the ER. And over the next few hours, and while I'm waiting in the ER in the waiting room, which is terrible, by the way, I started getting immense, exponentially worse pain in this flank region. Became like 9 out of 10, 10 out of 10. And, I couldn't even sit down in the ER waiting room. I was kind of pacing around, kind of like grimacing, leaning over the chair and stuff, and just in terrible pain. And the guy who takes your blood there, initially before you go back, he kind of made me think, oh, maybe it's a kidney stone or something like this. That's kind of what it presented as, honestly, first. But eventually, a few hours go by, I make my way to the, back into the doctor's area, get into a room, and I start, for whatever reason, right when I got to that room, I start kind of hyperventilating. My face turns white. I get nauseous from just the terrible pain I was in. And I thought I was about to like throw up there, or pass out, or what have you. But thankfully, the doctor came in right then after we kind of asked him, and gave me, some morphine and Zofran, like an anti-nodule medication, and that kind of, thank God, saved me right there from throwing up or whatever I was about to do. But then skipping through a lot of um, the ER details. I ended up getting kind of two CTs. One of them was kind of basic. The other one was with contrast dye, and they ended up showing that I had this thing that I had never heard of, and never knew for my 25 years of life. But it's called a UPJ obstruction. Um, um, I think the exact acronym meaning is ureteropelvic junction obstruction. Could be slightly wrong on that, but anyway, so it's a basically it's a narrowing or a blockage in the tube that connects your kidney to your bladder. So you got your kidney kind of right here in the flank regions, one on the left, one on the right, typically, and you get your ureter is kind of a tube that goes down and then into your bladder, right, and it carries the urine through your body so it can be expelled. And a UPJ obstruction, it can happen because of any number of reasons. It could be, traumatic, like you got in a car crash, something, uh, you know, damage that ureter, or um, it could just be, and this is in most cases, it could just be congenital. Um, and most people, I think, find out about it when they're kind of a baby or a toddler, and they get it fixed if needed, or it just kind of fixes itself. But some people, they don't find out until they're, my age, like middle aged, 20s, whatever, or old age, 70, 80. Um, so what happens when you have that thing is the basically the urine can't pass through down to your bladder effectively. So it's kind of blocked up right at the ending of the kidney where it meets the ureter, and it just kind of swells up your kidney real bad, and it is very painful when it's kind of one of these acute episodes. But so yeah, I ended up staying the night in the hospital. They thought they were going to and by the way, this for me, we found out this was probably a congenital thing I just never knew about, but it just happened to pop up and cause symptoms when I was 25 for whatever reason, but I never knew about it. And terrible timing with the back injury as well. But anyways, I stayed the night at the hospital. They think they're gonna have to do this thing where they put a stent in me, which it's kind of like a flexible tube, or like a PVC pipe, maybe you could think of, and they kind of insert it into your ureter to kind of keep it open, as opposed to constricted like it was, so urine can pass through. And you kind of have this device in you that helps the urine flow until you can kind of correct it in a more permanent way through surgery or some other technique. But I come to find out later, and I've had my time with the stents, but those are not fun to have in you. But anyways, so they thought they were gonna have to do that, but the next day I ended up kind of my pain reduced throughout the night, and the next day I was feeling fine. So they ended up kind of skipping that, and I just got sent home. But I needed to see the urologist there, who kind of specialized in robotic surgery. And this was kind of a local hospital near me, pretty reputable. So I was supposedly, in good hands, and I was, but we'll get into that later. But anyway, so a month goes by. I kind of get this. I kind of start feeling it more and more every day in my flank region a little bit, but then as opposed to just have never having felt it before, kind of becomes a daily slight annoyance to me, minor pain in the flank. But I ended up having the surgery, a consult with this surgeon in September, mid-September, kind of a month after, and he basically looks at the scans. He said, "Yeah, you got this UPJ obstruction." I had it mainly pretty bad on my left, but it showed a little bit of the same thing on my right. But my right side wasn't symptomatic at the time. So, anyways, he said, "Yeah, you're gonna have to correct this left side problem eventually with a surgery called a robotic pyeloplasty." So, just complete basics. They have these surgical robots where they have several arms and they kind of stick them in your abdomen, make small incisions, and it's kind of better that way than an open large scar surgery, and more kind of precise. But they stick these robotic arms in you. They get to your ureter and they kind of cut out that narrowed portion of ureter and then restitch it back together typically. And this can, this is the surgery that kind of corrects the problem the best. And so I ended up being like, okay, like let's just get it done. I had never had a surgery before this point, so obviously I was very nervous. But I ended up, having to schedule that for I think around December of 2024 initially, because these surgeons are very busy on their schedule typically. But ended up having increasing pains on that left side day to day, and it was just getting very annoying, kind of hindering to day to day life, having a pain like that and weird kind of abdominal symptoms. But so I messaged him that we were thinking about putting a temporary stent in, but ended up being able to push that surgery up to October 14, 2024. So I ended up, going to that surgery very nervous the day of. But what they do is they do that pyeloplasty surgery with a robot. You stay in the hospital. It can be anywhere from, one night to several nights, depending on how you're feeling and stuff. Typically, it's just a one night stay and you're out. But they do the surgery and then they put a stent in you for maybe 4 to 6 weeks. In my case, it was 6 weeks each time. And come to find out, and if you look on Reddit, you'll see that having these stents in you can often be kind of worse than the initial problem themselves. I mean, people range on how they feel with that device inside them from, it wasn't too bad, didn't have a problem with it, to, this is hell on earth. This is the worst thing I've ever experienced. I'd never go through it again. So wide range, but typically it's not good when you have that thing in you in terms of discomfort and a bunch of other weird symptoms. But I get the surgery. I was pretty down bad after it. Didn't know what to expect. Was in, a lot of pain for the first few days, and I had this. They put this drain in you, and it's called a JP drain, and it kind of a lot of times for me that was the worst part because it like hangs out of you and like pulls on your inside in a way, and when they take it out, it's it's not fun. But so I had some problems at the hospital. I was using a walker for a couple of days or whatever because I was in a lot of pain and couldn't really move around too much and had problems with that drain, like I said, and some dizziness and stuff. But eventually I get out of there after maybe 3, 4 days, I forget, and I then go home, and my back kind of flares up at this point around the surgery. It's all terrible stuff, but I have kind of 4 weeks of recovery that I make it through to, and that was not fun. You have kind of weird symptoms with your region down there. You can get, you get like weird irritation and weird feelings when you urinate and stuff like this. And eventually over the couple weeks, um, I had weird, fevers at times and stuff like this, and weird chills for a few weeks after it. But I thought things, was gonna suck, but I thought things were gonna go well, and they said the surgery went well. So I thought, just grind it out for 6 weeks, and then it'll be fixed for good. But again, like I said, I only made it 4 weeks until something bad happened. So 4 weeks in, I kind of feel that terrible left side flank pain again, like when I was there in August in the ER. I feel it one time in the beginning of the day, and then the second time later in the day, I end up taking a pain medication that kind of dies it down the first time, but the second time, even after taking that pill, it does nothing. I got 9 out of 10, 10 out of 10 pain, and I was also seeing like blood in my urine a lot more frequently. Like at that point, it was like sometimes it came out like straight, like red. So I knew something was probably wrong, but that severe pain made me go back to the ER. They kind of took me in, did another CT scan. They saw I had like, severe swelling of that left kidney, and I was in immense pain again. So they kind of gave me some pain meds, kept me till the next day. And, very long story short, they didn't know really what was going on. The stent looked like it was in the right position, but it's nothing had like moved with it, or nothing seemed super problematic, but something was going wrong. So they decided to do this thing where they took the stent out of me, and supposedly for just a trial period, we're going to put something called a nephrostomy tube in me, or nephrostomy bag. So this is terrible, and I'll get into it, but it's kind of like an external drain, leading out of your body that allows urine to kind of bypass your normal flow and be drained externally. So it's like a tube coming out of your backside flank, into the open air, and then it kind of gets attached to, for lack of a better words, a piss bag on your leg, and you kind of strap it onto your leg with either straps or some sort of, mechanism or whatever. But so I thought, okay, maybe, and they said that I would have this for a week at first, and then they do a test to see, what really happened, and if the surgery failed or not, basically. And so I wait a week. They do a procedure where I remove the stent and get the bag placed in me. I was kind of like half asleep for it. They do the twilight anesthesia, but I was in the hospital again for maybe a day or two. And having that bag in you, especially when you're getting first used to it, is not fun at all. It's kind of like the JP drain, where you kind of feel something tugging on your insides if you didn't secure it well in the first couple of days, and I was having real struggles with it. And it's a big adjustment. You got to empty the bag into the toilet and lean over, and it's just weird stuff. But so they do that procedure. I got the bag in me. I go home after a few days, and I kind of await my fate. In a week, they're going to do a trial where they stop up the flow of the bag to see how your natural ureter is functioning. And they did that test, and they kind of push some fluid through your natural ureter flow and see if it goes through or not, and how it's looking on the live x-ray. And right when they push that fluid through, I got some, intense pain, and knew something wasn't right. It just felt completely blocked up there. So that was pretty depressing. They kind of confirm it on the report and the x-ray, and basically the surgery failed there. My ureter was like completely scarred up, I'd come to find. And this can happen. It's kind of, a lot of the data ranges with these pyeloplasty surgeries, depends kind of on the surgeon and circumstances, but there is kind of like a 5, 10, maybe even more chance that these surgeries just fail and people have to get redos or kind of less invasive procedures, or live with stents or nephrostomy bags or what have you. But mine failed. My surgery failed, unfortunately, and so I was kind of left stranded for a few months while I figured out what to do. So now from maybe that was kind of mid-November ish to January, beginning of January, I had this nephrostomy bag, and I was living with it. I'll make separate videos on more details on all of this, but it's terrible living with that. Showering is terrible with it. I had to wrap myself in plastic wrap to shower, and you gotta like pin it to the shower curtain and all this, and it can give you some weird pains or discomforts, and it's just not fun having that thing in. But more detail in a different video. Anyways, so I was in that kind of period, and I had to figure out what to do, right? So the surgeon hadn't really had that case happen to him before, so he kind of tries to refer me to this guy at Johns Hopkins who does some of these redo procedures, and it's called kind of ureteral reconstructive surgery, and it's kind of an upper echelon in a way for things like this. But that ended up falling through, and so I'm just kind of at my apartment doing my own research, and was on Reddit kind of looking for info like this. There's not a lot, unfortunately, so a video like this is good, but somehow, and very thankful for this random person on Reddit, but I kind of found this guy who was in a similar situation to me, perhaps, at the end of it, even worse problems than me in terms of kidney surgeries. He had multiple of them, and, ureteral problems. And he had advised me of kind of the top 3 surgeons in this issue, right? So in the world, or in the US at least. And he gave me a lot of info on this, and I did a bunch of my own research, but eventually I kind of narrowed it down to a kind of the actual number 1 surgeon in the world for this kind of ureteral reconstruction. I'll just shout him out. His name is Dr. Daniel Oon. He's over at Philly, and he used to be at Temple University Hospital. I think he may have moved recently, but anyways, thankfully I find him, and he does a lot of these redo procedures, a lot of these complex reconstructive cases. And so I end up having a consult with him, and and let's stop for a moment. So throughout these months from November to January, I told you they saw some signs of the problem on my right side, but it wasn't problematic yet. Well, during this time when I had the bag, I started having pains on my flanks in my right side, kind of daily, and worsening now. So unfortunately, I suspected it was same problem on the right side as well. But I needed some scans and such for this, but end up consulting him, and the plan is, my left side's completely messed up. I got to get that redone, a redo surgery. There's several options, but we won't get into that for kind of how you can do these reconstructive and redo cases. But so we know we have to do the left side, and the right side's kind of tentative. They're going to do scans when I get up there to Philly to kind of confirm if I have a problem there. And so I schedule this new bigger surgery for January 9th on in the new year. So this is now 2025, and I got the bag in me for a few months. I'm just waiting for my surgery. I'm kind of in a limbo state, and I end up having to drive up there to Philly on January 9th and do this major surgery. And skipping all the details in the scans, it shows that my right side's problematic as well, and my left side is completely stopped up, obliterated from the last surgery. So they have to do a bilateral at the same time robotic surgery again. So I can show this later, but I got like 10 scars on my stomach now from all these robotic ports being placed in me. But so they do that surgery. I think it lasts like maybe 6 hours or something. It's very intensive major surgery. He's probably one of the only, if not the only surgeon in the world who can do both of those surgeries at the same time. So that's a pretty rare thing. But anyways, so I get one redo pyeloplasty on the left side, one first pyeloplasty on the right side, and then I have to wear the stents in me. This time, two of them, terribly enough, for another 6-week period. And this kind of begins the worst kind of period of my entire life. Honestly, the recovery after this was brutal. Ended up having to, so I kind of spend a couple of days in Philly. They say the surgery went well, and I drive back a few days later to DMV area, stayed in my parents' house for the next foreseeable future, and the recovery after this was terrible. I kind of separated into three main issues. The first one was kind of the shortest lived, but I kept having these weird kind of dizzy spells. I was taking a lot of medication, right? And mind you, I'm going through this back injury. I'm just staying stagnant or getting worse with it the whole time. I can't really do anything with it. And so I was taking, strong painkillers after surgery. I was taking, sometimes I would take like muscle relaxers if my back was feeling it, or I was just taking all sorts of medication, like these weird oxybutynin, it's called, and to like relax your ureters and prevent spasms. And sometimes I would take a certain combination of these, or I would just, and I would feel very strange or dizzy. It was very concerning, and lightheaded or disoriented, delirious. And I ended up, sometimes when I would, take some of these medications and I would start to fall asleep or like nod off at night, I would get scared that I wouldn't wake up or something bad would happen to me if I kind of went unconscious, so to speak. That's how strange I felt. And that was one issue. But so I kind of muscled it out with the pain and kind of went off all these meds just because I couldn't tolerate a lot of them. So I was just kind of on Tylenol and a few minor ones by the end. But that was bad for a couple weeks. Then second issue was also kind of short lived, but several weeks throughout the surgery. And those 6 weeks that I had the stent, and even afterwards, were I was in horrendous pain every day. When you have these stents in you, they're, especially if you got like narrow ureters, they can kind of rub up on your ureters and cause like spasms, pain, just like in the flank area and stuff like this. And I had weird abdominal pains and like incisional pains that were very severe. I had to go to the ER one time for this because I didn't know what was happening. Ended up just being pain and irritation from the stents. They did a CT. I thought maybe it could be like something from the incision, like I had a hernia or a hematoma or some weird thing, complication after these incisions. And ended up just being the stents. I didn't have anything like that, but it was very scary. And when I had these stents in me, the pain and spasms, especially with two, and were so bad that I was virtually just bedridden for like 6 weeks. I could barely walk on the treadmill at a point 0.5, to 2 mile per hour speed. I tried to go on walks outside. That's important to me, but I just could barely hobble around in the street, and I had to give up. So it was very depressing, just lying in bed there for 6 weeks. And throughout this time, I mean, you're just kind of in limbo as well, because you don't know what's going to happen after those 6 weeks. Is it going to fail again when they take the stents out? It's a whole nother topic, but anyway, so I had all that for 6 weeks, the pain there, and the last one was very strange and unpredictable. I Several weeks after the surgery, I started getting these weird kind of chest pains, what it felt like kind of acid reflux at the time, and this is the beginning of a long-lasting problem for me that still lasts to this day. But I thought it was acid reflux, and I just kept having these chest pains that got worse and worse throughout the next weeks to months, and ended up I didn't know what it was. Went through a series of tests later, which I'll share. But I went to the ER once again for that pain because it got so bad, several weeks after the surgery, and they just gave me some antacid meds and said, meet with a GI guy. And anyway, so I now I got this worsening chest pain that was probably the most horrendous, one of the most horrendous things I've ever been through. As time went on, it got so bad that it would, last all day. Pretty much every day I had weird difficulties swallowing, or I felt like things were kind of coming up. I thought it was terrible acid reflux, just an immense burning in my chest, and kind of difficulty breathing at times. And so I went through, or let me just finish on the kidney stuff. So I make it through the 6 weeks. I get the stents out and don't know what's going to happen. I ended up, things were looking good after the stents came out. Thank God. But so I was peeing normally right after they came out. That's kind of one test to see if things are working, and then see if your urine's kind of looking fine. No like terrible blood, no terrible pain afterwards, or ER level pain. But so things are looking good after those stents come out. 6 weeks, but I still have these residual pains in my kidney for that ended up lasting close to 5-6 months, and even still kind of last now, but extremely reduced. But so it kind of gradually reduced over time, but I still had flank pains and weird spasms for the next 5-6 months. End up getting they do kind of a scan to confirm at 12 weeks if your flow is looking normal in your ureters. It's called like a nuclear renal scan, and I get that at 12 weeks after the surgery, and things are looking great according to the surgeon. So it looks like both sides are fixed up, and that's amazing. Was very worried about the outcome of this, if it would fail, if it would eventually fail. Still am a little bit, but it's been a while since then. I'm recording this on Christmas Day, December 25, 2025. So just for a time frame when this is being recorded. But so I had that residual pain 5-6 months, but no problems so far. Surgeon said the flow was looking good, and things seem to be fixed. But I'll have a separate video on more details of that. But I still keep getting these worsening chest pains, and it's to the point where it's like terrible every day and very concerning. So I meet with a GI doc. I go through a bunch of scans to determine what actually is causing this. Is it acid reflux? Is some weird hiatal hernia I had theories on. So I go on this regimen of acid suppressing medications, at increasing levels to the point where I was like on the maximum um, at a certain point. But my first test was a barium swallow. It showed nothing. It's where you kind of chug this weird liquid and they kind of do an x-ray of your throat to see if you have any swallowing problems, acid reflux, weird abnormalities. Came back completely clean. Then I had what did I have next? I had a endoscopy several weeks later because it wasn't going down, it was getting worse. That was completely clean. Nothing abnormal there. And I was trialing a bunch of these weird medications like spasm drugs for your esophagus in case it was some weird esophageal issue, or I was trying like kind of ulcer type medications, trial basically everything, but eventually everything started coming back clean, and we the doctors and the algorithm which you use to determine what your chest pain is kind of led us to believe that this was kind of a stress related, anxiety related thing, from all this stuff I had been through, culminating. And so it's something either called functional chest pain or esophageal hypersensitivity. Kind of big terms, and I'll get into them in a separate video, but it's basically kind of unexplained chest pain in a way, or unexplained acid reflux type symptoms. So you can have some sort of mind body dysregulation where your brain just kind of creates pain in a certain region, and or you're just extremely hypersensitive to normal reflux events throughout the day, and you're just hyper vigilant on all this stuff. So a normal sensation could feel like death, basically. And so it's one of those two things, I come to realize. And the treatment for this is kind of strange, but it's these things called neuromodulators. It's like things that can kind of reduce nerve pain in a way, and stress, I guess, overall as a side effect. A lot of it is like low dose antidepressants, and kind of nerve pain esque medications. So they knew I was under a lot of stress. They knew it was probably one of these conditions. So I tried. At first, I was on Prozac for several months at a low dose. That was a big, weird one for me. I never expected to be on a medication like that. And that was around March or April. Okay, sorry about that, guys. Had to split this video into two parts. That previous video was getting a bit too long, and just had to take a break there. But so circling back to those chest pain issues I was having. Just for reference, the time period I'm speaking of is kind of late March, early April of 2025. So I mentioned that it was determined that this chest pain was likely something called functional chest pain or esophageal hypersensitivity. And like I said, the treatment for those is generally twofold, but it's mainly those neuromodulator medications I described, and the other method is more of a kind of mental and behavioral approach where you can work with kind of specialized pain psychologists or pain therapists who kind of specialize in these mind body conditions to try and cure it that way, and again kind of relieve stress, anxiety. There's some other tactics kind of similar to that that you could try, but they're more kind of non meaningful in my eyes. Like some people do acupuncture, kind of weird things like this, but generally there's kind of those two routes. So just to start with kind of the medication side of things, I ended up firstly getting prescribed Prozac, like I said, at a low dose, and that actually managed to kind of over the next several weeks to month or two, I forget exactly how long I was on it, but managed to reduce my chest pains by maybe 40-50%. um, and that was good. At least I was moving in the right direction. um, the first numerous weeks on the Prozac, I didn't really feel any change to my mental state, really, except for a few, maybe a day or two where I felt kind of strange. But anyways, my chest pain was reducing. I was still on the antacid meds, starting to kind of somewhat, go back to my apartment and try and piece back together my normal life. And I was on a very strange diet at the time too. I kind of thought it might be acid reflux, and I eliminated a lot of foods to where my diet became like, I'd have like oatmeal for breakfast or yogurt or something like that, and then take like salmon and some veggies for lunch, and then just somehow landed on chicken soup every night for dinner. I kind of didn't really deviate from that setup for honestly a month or two at a time, and I was kind of trying some different regimes. I tried kind of everything in the typical acid reflux playbook. So I was had to try and force myself to eventually sleep on elevation on a wedge pillow. For a while, I was taking these alginate therapy. It's called, where you take this kind of weird substance after a meal, and it kind of stops food from going, up your throat essentially, or any acid reflux, or attempts to at least. But I was drinking like alkaline water to try and fix my pH. All I kind of went in the weeds with this whole acid reflux type regime. But anyways, the Prozac started helping me a bit, but unfortunately, kind of maybe several weeks to a few months in on that, I started experiencing these weird side effects of the medication, um, or at least I think were caused by the medication, where typically it was kind of me feeling just not correct in the head, to be honest. Just I usually like to take a morning walk, or a few walks outside a day, and I would feel dizzy, kind of lightheaded a bit on these walks. I would feel kind of delirious and had a lot of brain fog. Sometimes like increased anxiety and panic. Um, and I'm not sure how much of it was just the medication versus just me being in a fight or flight stressful state for so long. But that started happening to me. It was very frustrating. I had no idea really what was going on, but I had to kind of assume it was the medication eventually. And I think I tried lowering the dose a bit and then swapping to Zoloft. I was working with a psychiatrist for this type of treatment as opposed to the GI mainly, but because that's what they informed me I should do. But I think I tried to swap to Zoloft and go on a lower dose, but I still kind of got the same symptoms. And I eventually was just like, I've kind of had enough of this, of feeling like this. It was really, really just terrible feeling that way. I was not feeling myself at all. So ended up hopping off um, those types of antidepressants after several months of trialing, and my chest pain was still pretty bad, but it was a lot more manageable and reduced than it was in the heyday, more around my surgery time. So then I kind of went through trialing some other medications. I was on this thing called gabapentin, which is more typical of like a straight nerve pain type of medication. Like for sciatica, for example, I had tried gabapentin, and that one I was taking kind of a low dose as well, and kind of just doing it for a what if kind of thing. And it's less kind of mentioned in the literature for this type of problem I have, but it was worth a shot, and it produced a lot less or even no side effects to me at the doses I was on. But in the end, it didn't really do much to reduce the pain at all. And even the 50% pain I was feeling was still terrible every day. So eventually, I think I kind of was at a stage where I kind of had enough again of like, okay, I'll try something else, even if it may affect me mentally, because living with this pain for so long is just terrible. And kind of one of the first line medications or types of medications for this, functional chest pain type stuff is something called a TCA, tricyclic antidepressant. It's kind of a older school medication or antidepressant compared to the SSRIs, and it's supposed to act to a greater degree on actual nerve pain and firing, as opposed to just SSRI, which is more of a pure mental thing. So that's kind of the actual first line medication for this is something called amitriptyline, or one that produces less side effects is called nortriptyline. Um, so I opted to try this thing called nortriptyline. Um, Again, it's a very low dose where it theoretically shouldn't give you any mental side effects or have a typical antidepressant effect. It's just more so for kind of nerve pain type symptoms and chronic pain things. So I tried that for several weeks, and it actually seemed to be going fairly well and reducing my pain to a good degree, to where it was, a lot more manageable again and reduced. But eventually, I started having those same kind of brain fog, mentally off, kind of delirious feelings, and I kind of kept going back and forth in my head, like, is it better to live with the physical pain of the chest pain or deal with these side effects and feel strange every day. And as much as I hate the chest pain, I chose to live with it as opposed to the mental problems. I don't know. I guess in my head, I'd rather be kind of sober mentally than and deal with the pain than vice versa, and feel um, non-sober and but my pain's reduced to a good amount. But so I end up popping off that as well, and around this time I started, and this was probably or undoubtedly the biggest needle mover in a lot of these pain conditions and kind of the stress levels I was under, was seeing a specialized pain psychologist or even more so specialized kind of gut brain psychologist, and found him through my own research. And even when I came off the nortriptyline after several months with him, my chest pain started kind of magically, albeit slowly, vanishing over time. And so in the end, it wasn't fully really the medications that helped me. It was kind of just removing myself from a lot of that stress and working with that psychologist. And I ended up, over the several months until now, now being December 2025, I'm kind of, the chest pain's reduced by maybe 85%, I'd say. Um, Maybe even 90% ish, to where it's more of a rarity for me now. And I can, um, I'll have a flare up here and there for a little bit, but then it'll kind of go away. And is definitely nowhere near as severe as it was. I have returned to kind of a pretty much normal diet. I slowly kind of tapered off a lot of these antacid type medications. You don't want to cold turkey off of them because you can get like rebound symptoms, but I'm almost off pretty much all of it. I'm just kind of on the final taper here. And so, yeah, I'm very grateful that things are mostly better with that, but it's not completely removed from my life. I think more stress probably triggers it, but it's hard to pinpoint exactly when it's going to happen or what will cause it. It's kind of a mysterious thing, and honestly, not talked about really much or at all on the internet. There's a few Reddit posts here and there, but they don't go into much detail. And I had to do a lot of my own research. There's some medical literature and kind of an algorithm on this, but it's hard to pin down unless you're really in the weeds. And I'll probably make a separate video more detailed on this because it's really a topic that could provide value to a lot of people who are going through this and are just extremely confused. Um, so that's where I'm at now with the chest pain. Still working with the pain psychologist, and kind of as a side effect of all this, just had tremendous stress, anxiety, and kind of was living in a fight or flight kind of state a lot of the times. And I would wake up and not know how the day would progress or how it would feel, and kind of wake up in a semi panic, so to speak. And he's really helped me with a lot of that aspect as well, kind of getting over the, resetting kind of my nervous system there and learning to try and relax again and kind of stuff like this. So yeah, throughout this time, that was another thing. Definitely increased stress tremendously, anxiety, and probably have some PTSD from all this stuff. And but working through all that, and the residual kidney pains I was talking about are, I'd say, 90 to 95% reduced. I mentioned, and this is somewhat uncommon, but it's not unheard of. But I and other people as well have had these types of surgeries or these kind of issues, and there's scattered reports that there can be some residual pain lasting weeks after the stent removal, days after the stent removal, up to, what I experienced, 5, 6 months, or sometimes people even, you know, keep experiencing these types of flank pains, throughout the rest of their life, unfortunately. But so I was in kind of a weird subset that continued to have pain for a long time, even after I was supposedly, cured and fixed on scans. But it very slowly died down over those 5, 6 months. I had kind of some weird kind of muscular guarding, I think, around that area that caused some discomfort around there. And I still, even to this day, get the odd twinge or kind of spasm there that I can feel, but it's not problematic. I had and still have, to some degree, some kind of, my urine kind of looked weird for a while. It was kind of hard to explain, but it looked like there was kind of some residual kind of protein or like inflammation or things coming out of there after the surgery. But that's just something you got to learn to live with. Try and not stress about it too much. But yeah, I'm glad that's reduced to a significant degree. And it's, I get the rare. It's more of a rarity now that I get the odd twinge or spasm, like I said, or the odd period where it kind of, I feel some pain in the flank or some weird abdominal symptom. But pretty much good on that part now. The only concern with these surgeries, especially if you already had a failed one, is you just kind of worry about how long will this fix last? Is it going to last my whole life? Will it fail in 1 year, 5 year, 10 years? You don't really have a guarantee there. There's a lot of percentages thrown around, but and they're generally, very good in the 80-90% range once you get kind of a year out. But you never know. I mean, something could always happen. And there is kind of one issue I didn't touch on, and then a couple more minor ones that occurred throughout this, that I just wanted to quickly go over. So, on top of all this, somehow I also had another pretty major issue, or concerning issue. I I still tried to kind of keep up with my rehab as best I could and kind of stay relatively fit, like going on walks and doing what I could, and like maybe push-ups or what have you in my apartment while I had this stuff going on, and while I especially had that nephrostomy bag on me. So I think around Thanksgiving time of 2024, around when I first was in the first few weeks of having the nephrostomy bag, I was doing some kind of just regular old push-ups for the first time in a while, mind you, but nothing crazy at all. And I still tried to do my kind of PT type work for the back throughout all this, even when I had my piss bag in as best I could, but wasn't doing much there. Couldn't really do much on the back this entire time, just as a side note. But and that'll actually be the next topic after this. But so I was doing some push-ups in my apartment one day, and I think I didn't really notice anything at the time of the push-ups, but then several hours after, kind of the nighttime after that, I experienced this weird kind of tingling nerve pain going from both of my elbows down to my two fingers here, the pinky and the ring finger. And this was on both sides, but probably and still is kind of worse on my right typically, which is my dominant hand. But I started experiencing that, didn't know what it was. And over the next several weeks, it kind of kept continuing. I did a bunch of research trying to figure out what it was. I ended up developing this weird snapping sensation when I extend my elbow like this. You can't really see it on camera, but it's basically feels like something's kind of dislocating in here or snapping underneath all the parts you can see. And it's very, very annoying. It feels kind of gross, and it's pretty concerning when you are doing, maybe you're trying to do some sort of pressing motion or a push up type thing or anything that involves extending the elbow here. You can just feel it pop, 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 and it's a pretty discomforting feeling. And that was occurring on both my elbows. So now I have pretty much daily problems where I have this sometimes pretty bad, but mostly kind of minor to moderate, like nerve pain down my arms, and then this strange snapping in my elbows. Come to find out after thorough research and even some doctor's appointments and scans later on that it's some combination of all three or any number of the three of these conditions. So cubital tunnel syndrome, um, ulnar nerve subluxation, and or snapping tricep syndrome. I know those are big terms I just threw out, and I'll make a separate video again on this because it's kind of a niche and nuanced topic. But as of now, we think it's mainly the snapping triceps issue, and I don't have any major nerve damage. I think there's kind of some minor swelling or inflammation, I believe, but nothing really notable. And over the past several months, or I guess honestly, a year at this point, I have been able more so recently as I've been better to do kind of my own PT regimen, just kind of upper body rehab type things like you know rotator cuff work, some things for the wrist and forearm occasionally, but just a lot of kind of postural work, and I can get into that later. Kind of some ATG type stuff if you know what that is, but through several months of that and strengthening up after my surgery, I was able to kind of reduce the nerve pain almost 100%. It's kind of like it's barely there now. Sometimes it'll flare up or whatever, but it's mainly kind of a tightness in these forearms or feeling like something is, I don't know, maybe there's like something wrong with the fascia there or something, but or something's kind of constricted. But the major nerve pain has been reduced by that, and I managed to kind of reduce the snapping sensation by a fair degree, but it's still a big problem and occurrence for me, and I've kind of tried to work around it for now. But I think the main and what a lot of what I read, and I think the main cure for this is just to get a surgery. That's pretty intensive, but nothing as bad as my other stuff. But to it would be a surgery to kind of correct these issues on both arms, ideally, kind of separated. Um, but yeah, that occurring in the middle of all this is pretty terrible as well, especially with my aspirations to hopefully return to some form of weightlifting or just activity in general. Um, but I'm kind of in limbo on that. I'm kind of managing it for now. I might try some other things to kind of cure it conservatively or see if I can work around it. But I think within a few years, I may opt to get operations on both those arms. Um, Not the best. It's just something you gotta, push through, like a lot of this stuff. And another kind of niche issue that there's not a lot of info on. So I'll be happy to delve deeper on that as well at a future time. In terms of the back, um, I that's always going to be a tough one. It's a very complex problem, especially having that and going through all I went through on the side, and just allowing it to kind of or having to have it stagnate and kind of get worse is not good. And the longer you kind of live with those pain pathways in your brain and are unable to kind of fix it quickly or address it quickly, it kind of gets worse in a way and kind of gets cemented in your brain. But anyways, with regards with that, over the past several months, I've been able to. My main kind of program at this time is the LBA, low back ability program. Um, just through my own research and kind of trial and error and thoughts, I think that's probably my best course for now and in general. And I kind of mix it in with a few tweaks here and there, like modifications of some of my own exercises or thoughts, or kind of some things I learned from PT or what have you. But it's generally the LBA program and some upper body rehab and strength mixed in. But as of now, it's still kind of home workout level. I got the back extension. I do all that. I have kind of moderate weights at my apartment. I use the TRX kind of bands for some rows and kind of chest flies and stuff or upper body work. But it's still kind of, nowhere near kind of gym weightlifting bodybuild level yet, which I hope to return to in some form, but it's just a long, complex process with these back injuries. But from where I was initially and after my surgery, I'm miles better. You can see I can sit in this chair and work my, work from home job for hours. I've been able to go on some small trips recently and planted some larger ones. I, increased the intensity in my workouts and stuff and have returned to a somewhat normal life, but I still get a lot of troubles with the back pain. And it's just, like I said, it's a complex one. And I hope eventually to play the long game like he says, and see how this progresses in the next year plus. But this stuff is rough, especially if you live through it for a while, and it still plagues me quite a bit and hinders me. And when you live with chronic pain like this, my whole world has changed. My hobbies of lifting, running just disintegrated. Kind of my identity in a way shattered. And so I'm still kind of picking up the pieces. Don't know exactly what the progression will look like, but I'm happy. I'm very much so, miles better than I was. And that'll be kind of a further topic on this channel a lot. Just me trying to share my progress with a lot of this, mainly back injury stuff, and eventually, maybe trying to share some motivational stuff about me returning to the level of activity I want to be at. So that's pretty much it with the back. I did have some other kind of minor stressors throughout this whole thing. Obviously, I talked about the mental side. I randomly kind of started losing a bunch of hair when I went through all this, like stress related, slight balding in a way. I guess I noticed around the time of the nephrostomy bag era where I would be in the shower and I would run my hands through my hair and I would have like 50 hairs on here or something like that, and just it was really stressful just going through all this, and you're just like losing hair it seems, and you're just super stressed out, and started kind of thinning on the temporal regions here. You can't really see it too much now, but and I've had to go on the finasteride minoxidil. I think the stress just really sped up some things that were bound to happen, but thankfully it's kind of keeping it at bay, and my stuff isn't nearly as bad as some other people who are having hair loss, but still was very stressful. And yeah, there are a few other minor things, but kind of irrelevant for now. We'll get into them. I know this was a long one, so thanks for sticking with me. And I hope this can really help some people who are going through similar things, chronic pain, or especially if you're dealing with any of these kind of niche problems that I have. Just ask any questions you want, and I'm always happy to kind of share. I know there's not a lot of info, like I said, on a lot of these things, and I've done a lot of research and lived through a lot of them, so I'll be happy to help out and make videos in the future. But yeah, hoping things continue to look up for me, and just wanted to make this video as kind of the starting point of the channel, kind of my redemption arc. So thanks, guys. See ya.